Huge thank you to CIBC for making We Get It possible.
Hi, everyone, and welcome to We Get It, a program from Young Adult Cancer Canada. My name is Dani. I've been a part of the Yak community for quite a while now. I'm a colorectal cancer survivor, and I'm also an oncology social worker. I'm currently at Sunnybrook Hospital, but I always love to come back and talk to the Yak community. I'm joined today by Fiona. Fiona, would you mind kind of introducing yourself to the community?
Sure, I'm happy to do that. First of all, thank you so much, Danny, for having me on today. So my name is Fiona, and I'm an assistant professor with the Department of Oncology within the Division of Psychosocial Oncology at the University of Calgary. I'm also trained clinically as a psychologist, and I work a little bit of my time at the Alberta Children's Hospital with our long-term survivor program. And so my main job is really to do research, and my research focuses on pediatric, adolescent, and young adult cancer patients and their families, and trying to understand more the experiences that they undergo. And I'm really interested in the psychological impact of cancer, not only at the time of diagnosis, but through survivorship.
Amazing. How did you get connected to Yak?
That's a really great question. I have been a long admirer of Yak, and then I feel really fortunate. So, Yak has initiated an incredible partnership with one of my colleagues, Dr. Sheila Garland, and together they conceptualized a study that launched a few years ago now, that is, I think, fondly referred to as the Yak Prime study. I think the study and the launch of the study and the responses to the study were so positive that ultimately Dr. Sheila Garland and the Yak team realized that they had so much data and they were looking for partners to help them with their various areas of expertise to take a look at some of the data that had been collected by this community. So I was very fortunate to have been brought onto the team, maybe 2 years ago now, and have been working with the partners at Yak and Dr. Garland, as well as some of our other colleagues, to really try and analyze this data, to understand what the Yak community and young adult patients across Canada, not necessarily connected to Yak, what they've been telling us, and then to interpret the data and then ideally communicate that back out. And so it's a great opportunity to be here today to be able to do that.
Amazing. Thank you so much. What a good kind of summation of Prime and how it got started and how you came to be
Mhm.
involved here. That's really awesome. So, what research are you here to talk to us about today? Like, what's the big, like, drum roll, please?
Right. So I'm really interested in a concept that we kind of refer to as quality of life,
Mhm.
and I think this is maybe something that most people have heard of. I think quality of life is of interest to me because it's a subjective rating of one's own well-being. So it's like me saying to you, "How are you doing today?" And you being able to tell me, "Yeah, I think I'm doing okay," or not doing so well, as opposed to some more specific concepts that we tend to focus in on in psychology, like depression or anxiety. I think quality of life gives us kind of more an overall measure of how people are doing. It's multidimensional, so it represents an individual's general perception of not only their psychological, but also their physical and social well being. And it's important because it really serves as a general assessment of well being across multiple facets of functioning. So it's not just, I feel okay, but I feel okay physically, I feel okay emotionally, or maybe I don't. And I think what's really nice about quality of life is that it allows us to really quantify functioning for patients at the time of their diagnosis and long after. And because quality of life is a fairly accessible concept, we can then compare one's responses to other populations. So, for example, what we um, uh, proposed to do and accomplished with this study was to look at young adult patients and survivors and their ratings of quality of life, and then compared that to the general Canadian population.
Wow. Okay. So if I were to rate my quality of life, how would I approach that? Like, just for myself, how did you approach that with the community? Is it like I just kind of wing it, a scale of 1 to 10?
Great question. There's lots of different measures of quality of life and well-being. For this particular study, we looked at one measure. It was 12 items that people responded to, and then it was sort of broken down into two separate domains. So we looked at physical functioning, and then we looked at emotional functioning, and then we looked at outcomes of the physical and emotional functioning separately, compared that to the general population, and then also looked at factors that might predict physical and emotional functioning in young adult survivors.
And what would be some of those like prediction factors?
Yeah, great question. So we looked at factors such as sleep, such as income level, such as type of cancer, stage of cancer, time since your diagnosis, as well as some other psychological domains. So fear of cancer recurrence, body image, presence or absence of social support.
Okay. Yeah, that makes sense. I could see how those things would have a pretty big impact on like your emotional well-being, your physical well-being, all those different domains. Cool. So like what did you find? Like what's the kind of like what's the big news?
So I'm a bit biased, obviously, but I'm super excited by these findings, and excited not in necessarily a good way, but in a way that I think this tells a really important story. So the first thing we learned was that certainly when we looked at young adults ratings of both physical and emotional well-being compared to the Canadian population, they scored significantly lower than the Canadian population. And I think it's important also to realize that when we compared to the general population, we matched for age and sex. So this wasn't like, we're looking at the Canadian population of, individuals who might be older in life. This was looking at a cohort of what we tried to make were kind of identical in terms of age and sex. So they're doing significantly worse in terms of their physical and emotional well-being. We also sort of categorized those ratings of quality of life to be okay, you're experiencing poor quality of life, or you're experiencing good to average or excellent quality of life. And what we found was when we looked at the physical functioning, young adults, almost 40% reported to be poor with respect to their physical functioning, and 50% reported themselves to be doing poorly in terms of their emotional functioning. So that to me is significant. Half the population of young adults from this community are reporting poor emotional well-being.
Wow. And so is this just for people that are actively in treatment, or does this also reflect people that are outside of that? Because I know that many in our community, after they kind of finish maybe an active part of treatment, if they're able to do that, they sometimes get met with expectations that like, aren't you better now? Like, isn't everything like okay? Shouldn't you get over it? Those are all things I kind of heard.
Mm-hmm.
So what is this taking a picture of? Like, who are these
So
folks?
I'm really glad you asked that. And for those exact reasons, we actually intentionally removed from our analyses any patients who were currently receiving treatment. So these are all patients who have completed their treatment and are well into survivorship. And actually our average time since treatment for the sample that we looked at was more than 6 years after completing therapy. So these are individuals who are well beyond what is traditionally conceptualized as the hardest, most grueling part of the journey, that active treatment part. But this is really showcasing to us, and I think this is a common message among the Yak community, is that the journey doesn't stop when treatment ends, and that really the implications, the longer term implications of being diagnosed as an adolescent or young adult are significant.
Wow. Okay. While it is really like hard to hear that the community is hurting, I think it also must be really validating for some folks out there, hopefully hearing this, to hear that like they're not abnormal. Like these are like you're finally capturing this data, this experience that I think we've been talking kind of internally to each other about, but it's sometimes hard to express that in, I don't know, in maybe a way that is fair or not, like more
Mhm.
accepted, especially in maybe more scientific communities.
Right. I think again, going back to the initial partnership between the Yak Prime study, the whole point of the study was really to be able to get this hard data to support, I think, what the community has been feeling or expressing or talking about amongst themselves. But now we have the numbers, and I think that's really powerful. I also think so the second part of the study was to look at factors that might be related to those poor physical, poor emotional health. And the good news is we found some factors related to those outcomes that are potentially quite modifiable. So sleep, for example, was related both to poor physical and poor emotional well-being. And we know that there are some excellent treatments out there focused on how to improve sleep. And so our thinking is now with this data, if we can say, okay, young adult survivors are struggling, but here are the factors that we can work on. And hopefully, if we can create more advocacy and more support for some of these interventions, ideally that means that quality of life can improve.
Okay. So potentially, like, we could have more and more medical professionals getting their hands on this information, and maybe even your family doctor recognizing that, like, I need to check in with sleep with this person. They've had cancer as a young adult. That's a concern. So, like, that kind of like mobilization, is that what we're kind of thinking about here?
I think absolutely. So I think there's kind of two messages here. One is that there are factors that we think that if we modify might help improve quality of life over time. Sleep was one, body image was another, fear of cancer recurrence was another. So I think those are things that we hope that if we can pay more attention to those factors, perhaps there might be an impact on quality of life. But I think for myself, the real important message is to the community in terms of validation, as you've suggested, but also to healthcare professionals to say, when that treatment ends, you can't just close the door and say good luck and be on your way. I think now we have the data to say real advocacy can happen, to say these patients require longer term monitoring, longer term follow up, and support and resources to help them on their way.
Amazing. Are there some other little tidbits from inside your study that the community would be maybe interested to know about? Some interesting points along the way?
I'm trying to think about what else we learned. I guess the other sort of take home for me when we talk about these modifiable factors is when we looked at a number of disease variables. So we looked at your diagnosis, we looked at the stage of cancer at diagnosis. We looked at the treatments that you may have endured, and really none of those were related to the physical or emotional well-being.
Wow.
So to me, that was quite striking that it didn't really matter what you were diagnosed with, the treatment that you've had, if you've had more severe experiences than others. I think it doesn't matter. Your quality of life is impacted. So that was important to me.
Wow.
Um, the only one demographic variable that we found was related to physical functioning was income level. And for those who were earning less than $40,000 a year, they were more likely to have poorer physical quality of life. And I think that makes sense. But again, when we talk about that within the context of what we know for young adults who are financially sometimes more challenged. And we have data now coming out also to show that the impacts on your financial well-being can be significant, and to see that that is also linked to your physical quality of life. I think that's an important message as well.
Huge. Again, just like some really validating things that you're bringing forward here. Circling back to that piece around it not being so linked to the type of cancer, the type of treatment, and whichever. I feel like there are so many people in our community that get told, like, oh, well, that's a good type of cancer, or oh, it was just whichever, it was just this diagnosis or just this stage. And it kind of gets used sometimes as a way to invalidate people's experiences. And I think that's so interesting. And again, just feels so true and right to me that that's not the biggest factor on the table, even though it often is treated as though it is.
Absolutely. Yeah. I, I've been engaged in some other research and not tied specifically to this study that has been working with patients who have talked a lot about, oh, I've been diagnosed with the good cancer, or this is supposed to be the Cadillac of cancers, and how detrimental those words can be, and invalidating for those youth experiencing this terrible diagnosis. And so yeah, I guess another take home there is, it doesn't matter whether it's a good cancer or what, that the impacts are significant on quality of life, at least for sure.
And yeah, just again, I think more evidence that brings us back to like the power of our words. And sometimes those words and the stories that we tell around cancer can be really damaging. And so hopefully this message kind of gets out there a little bit more, and we can stop hearing people being told, oh, that's a good type of cancer. Ultimately, you're still having impacts on your quality of life that are very, very real. um,
Absolutely.
okay. How, if I were like a young adult that's like kind of interested in research and wanting to see my experience reflected out there, how would I even go about doing that?
So that's a really good question. And I think, often on the other side of the fence are researchers who are often looking for patients to help partner with them in the work that they're doing. And so, I don't know. I don't know the right answer specifically, except to say to not be afraid, and to feel free to reach out so if there's research you hear about, or work that you are fascinated by, to feel free and not be intimidated, but to please reach out to researchers and say that you would love to share your experience, or you'd love to contribute. I think patient-oriented research, which is what we sort of call this, is becoming more and more popular is not the right word, but is definitely gaining more significance, and really realizing that the work that we do doesn't mean anything if those questions aren't driven by patients. And so I think, as I said, I'm always looking for individuals who are willing to share their stories, and to help guide us in the work that we do, and to say, oh, this research really spoke to me, and I'm wondering now about, next questions, and this has been my experience, and then really partnering together to say, okay, well, let's see if we can put some data behind your experience, and move it along. So I would say, don't hesitate to reach out. I really use social media these days to try and communicate with various communities, whether that's right or wrong. That has sort of been my go-to for now. I think moving forward, needing to be a little bit more strategic about that. But I would say there are a number of researchers active on social media, so that might be a place to start. But again, yeah, not being afraid to reach out, send emails, and contact individuals whose research you might be interested in participating in.
Amazing. Thank you so much.
You're welcome.
So, if I'm walking away today after watching this interview between us. What are like the key things that you want people to kind of like hold on to, and either share with their health team or with their families and friends or whichever? Like, what are the key messages?
So I think the first message is, first of all, thank you for contributing to this research. So if you took the time to complete the Yak Prime study, or if you've contributed to any other research, to please know that your voice in that process is important and allows us to make discoveries like this. So um, I would say thank you and continue to contribute to research because it is really important, and I think important to have your voice heard in this way. So that would be my first. The second is, I guess, a bit of a bad news story, which is that a significant number of your community are experiencing poor physical and mental health. I think uh, maybe that's not a bad news story. Maybe that's a story that you have always sort of known or felt. And now we have that data to really say you were right. And we know that this is a problem. My hope now is that with this data and with these numbers, we can move this forward to advocate for more support and more attention to this. So that would be kind of my take home too, which is maybe a little bit mixed with take homes. And then my final would be that while we're worried about your longer term quality of life, I do think that there are potentially some intervention opportunities or areas that we can focus on to try and improve quality of life longer term. So if we pay attention to sleep, based on the research, our research findings, so sleep, body image, fear of cancer recurrence, as potential targets for intervention, might we have the opportunity to improve quality of life over time?
Amazing. Thank you. What a good summation. And I think, like, again, if this is something that if you're hearing this and you're connecting to these things around quality of life, around your connection to your body, to your mental health, wherever, if this is like what you need to hear today to empower you to get some help and get some support in your community, be it from the Yak community or beyond, go for it. This is not an individual problem. I think we're seeing that more and more, right? This is a community in need, and so you deserve to get support. I guess just as like another kind of thing to tease out is what's next for you? Like, what after doing this research are you excited to know more about, or you think is an opportunity?
So I think that's a great question. I think this study has just started to scratch the surface a little bit in terms of understanding quality of life. And I think while I really like the idea of quality of life because it sort of is a bit of a catch-all, it also isn't very specific in terms of what that's capturing. So we can say, your emotional well-being is poor, but what does that really mean? Is that more depression? Is that more anxiety? Is that fear of cancer recurrence? What is being captured in that? So I think trying to tease it out a little bit more and understand where those reports or those ratings are coming from. And then I think really the ultimate is how do we improve it? How do we make it better? And so if we identify that it's a problem, then what are the strategies now or the resources now that we need to invest in, that we need to research to try and improve quality of life over time? And I think it's clear that we need to do something. But the question is what, and I think a community like Yak is phenomenal in terms of the peer support model that it provides, and I think for many it is a great way to improve feelings of well-being. For some that might be enough, for some it might not be. And so what are some other things that we can do, or other things that we need to look at to try and make improvements over time? Because I think it's clear that it's not okay to just sit with the idea that 50% are feeling are reporting poor emotional well-being.
Yeah. And so do you promise to come back and tell us more as you find out more?
Yes, hold me accountable. Yes, I will come back. I'm not sure how quickly that will happen, but I will one day come back and hopefully be able to report more.
Amazing. This has been such a lovely conversation, such a great, I think, way to start to dive into this. So thank you so much. If we've got some folks out there that are more like deep readers and they want to get their hands on the actual text, how could they go about doing that?
So really excited to share that this is coming out as a publication, and hopefully in the next couple of weeks.
Amazing.
And so that will certainly be shared with the Yak community, and I know that the members of the Yak Prime team are working on how to get this information out to the community once it's available.
So keep an eye out. I think we're even recording this a bit before we're in the past, but also
Right.
knows
Right.
when we are.
Yes.
It's happy holidays, at least a little bit behind me. So hopefully if that's already out and available, maybe it'll be in the description of this video or whatnot. But that's awesome that it's going to be accessible for the Yak community. I think that's so important. I think like that kind of wraps us up, I think, unless is there anything we didn't discuss today that you think should get on the table?
No, I just want to say thank you again so much for inviting me to speak today. I think as researchers, we sort of get stuck in our own little world, and we get this great data, and we publish what we think are really important findings, and that information doesn't really get back to the communities, doesn't always get back to the communities who need it most. And so the opportunity to speak today and share what we have found with the Yak community has really been a pleasure for me, and I really appreciate the opportunity to do this.
Well, thank you so much. It's I know for myself, just even speaking just from a very purely selfish point, it is so wonderful to know that there's all these passionate researchers doing this work and figuring out how to express these things that we know to be true. It's so exciting, and I know even in the time since I've been diagnosed, I've seen so many changes and so much energy in this area, and it really fills me with so much hope. So thank you for being such a big part of that.
No, you're welcome. It is an honor to work with such amazing people like you. So,
Well, thank you. Well, I guess that's all. Well, until next time when we drag you back on to tell
right.
us even more.
Amazing. Thank you so much.
Thank you.